WBUR Podcasts, Boston.
Hey, a quick heads up about today's episode. We will be discussing topics related to depression and suicide. If you or someone you know is struggling, you can find support by calling the Massachusetts Mental Health Helpline at 833-773-2445 or the National Crisis Lifeline, which is 988. Now, on with the show. I'm Daryl C. Murphy, and you're listening to The Common. Martha Bebinger, how are you doing?
I'm doing great, Daryl. How are you?
I'm doing good. Glad to be talking with you.
Same. Good to hear you.
So, you just finished this story about a program that provides mental health services to kids at home to help ease the pressure on emergency rooms and youth psych wards. Is that correct?
Yes, sir.
Now, we've talked about hospital strain in other contexts on the show, but I am very interested to know what that looks like in terms of youth and mental health.
You would mostly see it in an emergency room, Daryl. What you'd see is children in the middle of some kind of mental health crisis on gurneys, waiting for days, weeks, occasionally more than a month. Mm-hmm. If they are at a serious risk to themselves, you would see guards standing around them. Now, this is a problem that's been around for a long time because we don't have enough psych care in Massachusetts or in many places of the country. That's largely because it's not paid for in the same way that kind of more exciting types of care, fixing heart valves, for example, are paid at much higher rates. But it's also been worse during the pandemic because, as you know, rates of anxiety and depression and all kinds of things were worse when people were isolated at home. That's starting to ease some, but we have a backlog now of people waiting for psych care, and we still have this perennial issue of not enough psych beds in psych hospitals.
And now we have this program you wrote about called Youth Villages, right? Can you talk to us about that?
Yes, Youth Villages is one of 4 organizations that the state has contracted with to provide what they call diversion. And what that means is evaluating a child in the emergency room, as always happens, a psych evaluation, deciding could this child's needs be met at home, perhaps even better than in a psychiatric hospital. So it's not going to work for everyone. They don't have people who prescribe medication. So if your child really needs to have their medications stabilized or really needs to be on a lot of medications, maybe a psych hospital is better. But in the case where it may work, the hospital talks to the parent, connects them to one of these diversion programs, and that program in many cases goes right home with the family. Now, here's Matthew Stone. He's the director of Youth Villages, and he's explaining why home care in many cases may be better than going into a psychiatric ward.
Many of the behavioral health, mental health challenges these children are facing are being driven by factors in their home environment, their school environment, their neighborhood, their peer system.
And his point there, Daryl, of course, is that you're going to have to work out those dynamics that are triggering a child in the home setting or school setting eventually. So why not get right to that in cases where it's appropriate?
Now, your story revolves around a child named Haley who went through the Youth Villages program. Can you tell me about her?
Yes. So Haley is a 12-year-old from central Massachusetts. She had some bullying in her younger years, but she wasn't really involved in the mental health care system. But one night, her mom looked into her room around 2 a.m., and Haley wasn't there. And she wasn't anywhere in the house. So the mom panics and tracks Haley down eventually using one of the tracing apps that she had connected to Haley's phone. And she sees that Haley is walking on a main street in their town. Haley's mom and dad get in the car and go get her and bring her home. She had planned to meet an older boy that separately she'd been sending pictures of herself partially undressed. And the mom remembered that back in those days when Haley was bullied, Haley had said to her one time, I want to die. And Carmen, the mother, got really, really anxious then and thought, are we going to revert to that time when Haley seemed to have suicidal thoughts? So she said, we need to go someplace. And they didn't have any connection to the mental health care system. So their first thought was to go to a hospital emergency room.
And what happened after that?
Haley was there for 3 days. She had that psych evaluation within about 24 hours. And the people who reviewed that psych evaluation said, she's definitely exhibiting some risky behaviors. We don't know that she needs to be locked in a unit to avoid this. Maybe home is a possibility.
Yeah, I was about to say, I would imagine being treated at home is much better than being treated in a hospital.
In some cases.
Okay.
In Haley's case, it seemed like it would be better because she didn't have any experience with the mental health system. So to go from nothing to a psych ward was a big leap and might have added some trauma to her experience as well.
Right, okay.
So they opted to try this home-based care.
Okay, and how did that go?
It started in November, and it will probably end at the end of January. What it looks like is 3 days a week of sessions. As far as we know, Haley has stopped the risky behaviors. She has started vaping, so, maybe she's still having some anxiety around issues. But the mom and Haley both say they think the counseling is helping. Can I give you a little description of how and why?
Yeah, I really want to know, what's the strategy?
So Haley's main counselor is a woman named Laura Palizzotti. And Laura uses a lot of really hands-on techniques with Haley, teaching her to understand what happens inside her body when she gets scared or angry. One of the techniques that Laura used with Haley is this worksheet called an emotional thermometer. And it looks just like a big thermometer on a piece of paper with 5 lines from cool at the bottom to hot at the top. And Haley is going to fill in how she would describe her feelings at each stage of building intensity of emotion. Here's how she labeled the top, her red zone.
So when you're infuriated, how do you think you feel like physically? What do you notice?
My palms get sweaty. I make this face.
And then what is a coping skill that you could use when you're infuriated to calm yourself down?
I could go on the trampoline.
Oh yeah, that's a good one. Okay, so go on the trampoline.
They're hoping that this exercise, which they do in relation to all kinds of things that make Haley mad, like her mom yelling at her about cleaning up her room, or her mom getting mad when she doesn't, do her homework all on time. All of those things Haley can start to treat differently, as opposed to just letting that anger all bottle up inside her and start to plan another night sneaking out.
We're going to take a quick break, but we'll be right back.
Did you kill Marlene Johnson?
I think you're one of the first people to have actually asked.
From WBUR and ZSP Media, this is Beyond All Repair, a new podcast about an unsolved murder that will leave you questioning everything.
Somebody should be in jail for murdering my sister.
A woman who's never been believed.
As long as they think I have done this, then they're not looking for who actually did this.
And that's what makes it a cold case.
No, it's a botched case.
And a search for the truth, once and for all.
Wow, it just gets more interesting.
Beyond All Repair. Listen and follow wherever you get your podcasts.
Be careful. You're digging in a place that's been very peaceful for a while.
Do it anyway. Dig.
And we're back. What's the success rate for this program? You know, it sounds like Haley's doing pretty good, but how many kids in her situation make progress like that?
Yeah. Daryl, the state's numbers show that of the nearly 500 children who've been through this program, the vast majority, 83%, have not returned to the emergency room with a mental health issue. And more than 90% have either completed the programs or been moved to some kind of care that was more appropriate. So they're pretty happy with those numbers. Now, we don't have long-term data yet to show how this program compares to, you know, psych hospitalization a year after treatment or 2 years or anything like that. But parent groups are really happy with how this is going so far. In fact, Mary Viano, she's with this group called the Parent Professional Advocacy League, which advocates for parents of children with mental health issues. She says the main complaint is that there just aren't enough spots in these programs.
The hope for us really is to be able to have more slots are available for the diversion. It's working.
Mary Viano's other comment there, Daryl, is she just thinks hospitals don't offer it soon enough. And it's true, hospitals are really kind of getting used to this program at this point. It's still on the newer side. And so it may not be their first thought every time to think, oh, can this child be better served by going home with intensive care?
Martha, how does equity factor into all of this?
So there's different ways to talk about equity in this context, Daryl. One is, do hospitals offer it equally? And we don't really have the data to answer that question right now. The other way to think about equity is, are parents equally interested in this program, regardless of their background? And again, I don't think we have the data to understand whether there's a perception that hospital-based care versus home care is perceived differently. But there's a third way to think about equity, at least one more way to think about equity. And Carmen, Haley's mom, got into that a little bit during our conversation. She thinks a lot of parents want to sweep these problems under the rug. The suggestion is that may be even more true of parents like Carmen who haven't had any experience with the mental health system, who may not be attuned to mental health in the same way they are to physical health. Here's a little bit of what Carmen had to say.
And a lot of parents don't know what the kid's going through because they don't want to accept that your kids really need help. So that's why I'm doing this. I'm bringing you guys to my house. And hopefully this can help all the family, you know.
Daryl, Carmen was not all that comfortable having this interview. She said she doesn't like having people in her business. You know, she's a proud mom and businesswoman herself. And it was hard for her to ask for help. It was hard for her to realize that she wasn't alone in needing help, and hard for her to say to other parents, you know, pay attention. I'm just speculating here, but I think the diversion program may in some ways help with the equity issue because it gives people more options. It doesn't just say, your kid is in so much serious trouble right now that they need to go into a psychiatric hospital. It may be easier for many people to accept the idea that in-home counseling may work as an option for them rather than hospitalization.
If someone is listening and they have a young person who needs help, or they know a young person who needs help, where should they go to find it? Do they have to go to an emergency room to get access to these in-home services?
Well, Daryl, I am so glad you asked that question because, in fact, in addition to diversion, the state is just starting to open community behavioral healthcare centers. So centers where you can take your child in an acute situation right into a community-based center and say, can you give us the help we need? That center may say, no, you know, you need something more intense and send you to the hospital. And that center isn't open 24/7. So people like Carmen and Haley in the middle of the night are probably still going to go to emergency rooms. But the state is starting to open more options for people in the community so that the emergency room isn't seen as their only place of refuge.
Understood. And I also want to note that the Massachusetts Mental Health Helpline is 833 888-773-2445, and the National Crisis Lifeline is 988. Man, Martha, what a story. Thank you very much for taking the time to talk with us.
Thank you so much, Daryl, for your interest. Really appreciate it.
That's WBUR health reporter Martha Bebinger. And that's our show for today. Thank you so much for listening to The Common. Please give us a shout on Instagram or Twitter at WBUR The Common, or send us an email at thecommon@wbur.org. I'm Daryl C. Murphy, and I'll talk to you tomorrow.